Hi everyone, welcome to the NLP Summit 2024. Today I will speak about the use of large language models in patient education. A bit about myself, I'm a medical doctor by training, so I'm not a data scientist. I have also 2 masters, one in public health and one in business administration, and I'm also applying for a PhD in AI in medicine. My current role currently is as a health service researcher. My research topics are in AI, diabetes, workplace health. I've been recently appointed as a clinician advisor for AI lab. I still do workplace health advisory work. I also see patients once a week in a primary care clinic that's publicly funded. My LinkedIn profile is as follow. Please connect with me. And you can also connect with me via email. So first, let's recap what is a large language model. Basically, it's just a language model that is built on a larger scale with increased complexity and efficacy. So not only can it predict words, it can now predict even sentences, paragraphs, or entire documents. So some of you may be familiar with ChatGPT, where it can actually create recipes or even travel itinerary. So what are some of the growth factors that actually trigger this large rapid growth? Is number one, there's increased computer memory. The data set that is used to train is also quite huge. For example, from what I know, ChatGPT was actually used the whole internet available material to train it, and also with the processing power of the computers. What is interesting about large language model is that initially, as a predictor, it can actually have emergent properties that's actually unforeseen. So that's what's so exciting about ChatGPT. There's also effective techniques for modeling longer text sequences, and all these are really increasing the acceleration of this field. So from what I know, these are the top 5 large language model that's available. So most of you will be familiar with ChatGPT or OpenAI. That is actually quite widely used. Claude 3, that's the one. And then there are 2 that's also open source, which means you can actually install them onto your own computer on premise. But make sure that you have enough processing power, otherwise it will be very slow. So for example, there's Mistral 7B. If you look through some of the GitHub, you can actually look at the leadership board. So some of them actually perform quite well, and it's always like a race, a leadership board. So different LM model will perform on certain areas that's better. And finally, Google has its own Palm 2. Okay, so as a doctor rather than a data scientist, how I see that large language model can be used in a healthcare settings in 4 areas. First, patient education. I see that that's the first area you should go into because there's an ease of implementation. I'll elaborate on this further. Administrative work, for example, if you want to have an insurance claim, you can use this to actually generate reports. You can also use this to generate pre-authorization approval. So sometimes our insurance company requires you to submit this before they can even approve you going through another provider, especially those that are out of network. And healthcare education. For example, Khan Academy has actually mentioned that you can use AI to do adaptive learning. What this means is that first, they will actually assess the student to know what is their baseline knowledge. And from there, they can generate content that's tailored and personalized to the individual learner. Imagine a school that is for one. So that is what they talk about, having education using AI or large language model. For me, I think the greatest impact is probably in clinical use. But the challenge is that you need to have the buy-in of the doctors. You need to also overcome safety and responsible and ethical use of AI, because AIs currently still have biases, because a lot of the models were actually built based on biased data or incomplete data. Let's focus more on why I think that patient education is the focus that we should focus on. Firstly, materials are in abundance. You can actually find this material everywhere. Just Google anything about eczema, diabetes. There's more materials than not. The challenge is which material are actually reliable. Secondly, all these materials are actually easily accessible. You do not need to have a password. You don't even need to have a subscription. Most of this is actually readily available. And most importantly, it's not confidential information. There is usually no patient identifier in terms of these materials, which is why you can use it. A lot of time, clinical materials with patient identifier, you need to have a robust way to remove the identifier. Otherwise, you may get into trouble because this is actually medical confidential information that should not be shared. And finally, it doesn't require the buy-in of clinicians, because clinicians are very difficult to actually get them to be on board. So we talk about patient education, most of the time the clinician I speak to, they'll say go ahead, because it's not something that they really need to really intervene, or they think they don't really affect their practice. Actually, it does affect their clinical practice in a positive way, because you have educated patients who are actually well informed of their condition, so they can spend time asking questions that are more specific rather than general questions like what are the complications of this surgery, which is actually quite generic. And then they may start asking specific risks for them. Let's say they have diabetes. What is a specific risk for a person with diabetes rather than a generic? What is a complication of this certain procedure? The importance of patient education. Firstly, it leads to improve health outcomes. It's shown that well-informed patients, they are more likely to adhere to treatment plans. If you do not understand why you need to do this, without a clarity of why, you are less likely to actually follow through and take a medication. For example, if I tell you take this blue pill, and then it's hard for me to expect you to be compliant because you don't even know what this blue pill is supposed to give. We are telling you that this blue pill has certain side effects. You may be so fearful that you're not even there to take the medication. And they also make healthier lifestyle choices because they know that with this, they can reduce obesity, they can reduce the risk of getting a heart attack, they can reduce the risk of getting diabetes and so on. Reduce healthcare costs. With better education, hopefully patients will know when to see a doctor and when not to, when to go to the emergency department, when not to. And this will help to reduce fewer hospital visits and lower rates of preventable complications with better control. We also want patients to be empowered to make a decision, but how would you make a decision if you do not even know the basic information? So with a better understanding of your own healthcare or health condition, you can actually actively participate in the care decision. For example, you may understand that there are certain drugs that can take rather than this. So instead of saying, I'll take this medicine, you ask the doctor, what about this? What about that? Could you use conservative treatment instead? Must I go for operation? Why must I go for MRI, which is an investigation? Can I do a chest x-ray or so on? You also enhance patient satisfaction because it found that those who are more informed tend to have higher satisfaction rates compared to those without. And this is very important because with a better satisfaction, we may hope to reduce the number of complaint cases and the number of medical legal suits. Of course, there are some limitations on traditional patient education material. Firstly, time constraint. It's very difficult for doctors to actually, in the short period of time, to explain the condition. Some of the time, some of my doctor's friends, what they do is they just print the material and say, here's the material, please read it. But how often most of the time, they just realize that when they step out of the room, they are just thrown away in a dustbin. Yeah, so we don't have time to actually explain the condition properly. We just all the time, we just give them some material. Furthermore, what is worse is that the information may be different. Depending where you're in a different institution, or even different provider, the dietitian may give the different advice from the doctor, they may give different advice from the nurse. So with inconsistent information, it's not easy for patients to understand. So they may choose the view that they agree more, but may not be the right one. Patients get confused, in the end, they don't do anything. Literacy barrier, so jargon, medical jargon. I went to medical school for 4 years, but even then, for 5 years, sorry, but even then, there's so much thing to learn, especially all the different disciplines, all the different specialties. So this medical jargon can be difficult for patients to understand, especially those without higher education or those without the interest to actually learn them. This is an example. Okay, this is a National Diabetes Reference Material from Singapore. There are 4 areas: diabetes, healthy eating, physical activity, emotional well-being. You can see that there's 4 different versions. Why do I show this? Because if you want to have reduction in disparity of care, you need to have materials in all different languages. And this is not easy because it's time, it's effort to actually translate all this from one end. So the gold standard for translation is that we do this 2-way translation. First, for example, you use English, you will translate it to Malay, and then we'll try to translate Malay back to English to make sure that the information is accurate. So this used to be very time consuming and resource intensive. We usually hire some professional to do it, but with ChatGPT, with LLM model, you can actually do this quite easily, and you can even do a double check. So now you can even translate English to Malay to Chinese to Tamil, and then translate back to make sure that information is accurate and similar. The information is there, but it's difficult to access. All are just PDF. Yeah, so if you want to do anything, you download a PDF and read the PDF. And this is just diabetes. So what about patients with multiple conditions? They will even have a harder time to navigate this. So that's why with an LLM model or a chatbot, you can actually integrate all these together so patients can just query the question. So what are the advantages of using a large language model in patient education? Number one is 24/7 availability. Even a patient doctor can also lose the patience when the patient asking the same question throughout the whole consult. What is the risk of getting diabetes? I mean, this is something that is although it's important. So with a chatbot, they can actually help explain basic information, and then the doctors can then explain specific important things that's more specific to the patient, rather than wasting the time on more generic stuff. And this information can be instant, round the clock, and it's not just office hours. Also, you can personalize it. If you can actually program the chatbot to understand whether you want it to be factual or you want it to have stories, you want to have it to be very professional at a higher level, this can actually create information that's more suitable for you, for your literacy level. Consistency, can easily update the chatbot, the large language model, to make sure that information is the latest. If not, this whole process, imagine the process I show here. In the olden days, we have to redo the PDF. So if you look at the website, they actually have latest version 2018. So it's a hassle to actually update all information in different languages and so on. And finally, multilingual support, which I actually mentioned in the previous slide. So you can do this in different languages, and it also helps to break down language barrier. So you can ask the ChatGPT in English, in Mandarin. In the US context, maybe it's Latin, not Latin, but Spanish, and all the different languages that the minority may actually use. Okay, how to implement LLM in a healthcare setting? Of course, the first thing is do not reinvent the wheel. Please try to integrate it in existing portal and healthcare apps, because the hardest thing is to create a new thing, because people will not use a new portal, people will not use a new app. If there's existing portal, existing app, please try to incorporate. So for my company, National Healthcare Group, we do have a health app. So what we do is we use the LM model in the health app instead of recreating something else. And in terms of messaging platform, we use WhatsApp, for example. So use something that the patient's already using. To not reinvent the wheel, create your own like mad chat or something, and expect everyone to download it. That's impossible to actually do. Next is training. You need to train the people how to use it. Also need to train providers to explain to the patient how to use the portal, how to use the chatbot. Not just that, you need to monitor. Is it being used? How can it improve further? And how effective it is. Without this, it's very difficult to actually pour money to do this, because nowadays we need to focus on, is the money well spent? And finally, you also need to refine the things, make sure that responses is more accurate. Is there anything that the patient has feedback on? Try to add this in. You can even generate top 10 FAQ questions based on the feedback. So based on the information collected from patients, you even generate information and then you can look at the top 10 questions and see whether your existing materials cover those top 10 questions. So it's going to be an iterative process and not just a once-off effort. Okay, some of our challenges, these are quite straightforward. Firstly, data privacy. Although is patient education material, we still make sure that the patient do not key in sensitive information. For example, imagine a patient keying to the chatbot, I have HIV, and then this. We do not want to collect information about the patients. So we also do not want patients to share information that what conditions they have. We want them to search for information rather than share what information they have. So all these things are something to be very careful. So make sure that they don't upload their lab results, upload their medical content, and so on. Accuracy, of course, even though it's patient education material, we do still have to make sure that it's accurate and updated. And then these are some of the things we need to make sure. And even the LM general information, they need to be correct. So what we do now is we actually manually look at the LM model to make sure that the responses are accurate. Human touch. Important thing is there was an interesting study that found that ChatGPT actually gave more empathetic response compared to humans. I guess humans being burnt out and things like that, sometimes they lose the human touch. So probably we need to make sure that the AI, the chatbot, can still respond in a way that is not robotic, but with human empathy. For example, if the patient is asking for terminal illnesses, don't just give factual information, and then can also seek to say that this is just what normally people do, but there are exceptions. For example, people can live more than, let's say, 5 years, even with a cancer diagnosis. Then there's always hope. There are new drugs and things like that. So do not make the patient despair, but at the same time, you also don't give false hope. And finally, liability. But make sure that the advice given is there's a legal indication. So most of our chatbot, most of our patient education material always say, please consult a medical doctor. This is only for general purpose use only. Future direction, some of you may know multimodal LM. So it's not just text, it can create pictures. So pictures generally are not so good, but it can also integrate text voice. So for example, I can like Siri, you just ask a question, you record it from speech to text, and then you can even convert text to speech. For example, for those with visual impairment, so you ask a question, it cannot just give you the text, it can convert the text to speech so you can hear it. Yeah. And then it can also give personalized health coaching. So not do you just have information, you also want the AI model to actually provide things that are all constructive and actionable items that can do based on the your lifestyle and your habits. It's also going to give you real-time health monitoring. For example, most of us may have a Fitbit or Google Watch or Samsung Watch, some sort of a smart watch. All these things can provide information about your heart rate, about your steps and things like that. All these things can be integrated, and then they'll give you certain advice. For example, they send a message saying that, hi, you have not reached a certain steps count. Is something wrong with you? For example, you've not been moving. So they can send alert signals, patient may have fallen, things like that. So now let's share with you some of my project. The first project I'm doing is on eczema patient education. We just applied for a grant. Eczema is actually a skin condition that's quite common. So what we do is we actually have this patient education material, working with a clinician from National Skin Center. So with this information, we'll create an app, and then this will be integrated into WhatsApp or Telegram or Facebook or anything that the patient will use, depending on which country you are in. For example, I think in Japan they use Line. Yeah, so depending on which country you use, they'll be integrated to the message platform, and then you can give explanation on what is eczema, what are things you need to avoid, when to get a flare, when you need to see a doctor. The second project I'm working on is lung function test. This is not just to explain about the condition. This is to explain what you need to do. For example, there are some conditions, for example, spirometry. You're not supposed to take your medication before you go for a spirometry test. If not, you'll make the test invalid. So this is why we need to give clear instruction. Lung function test is something still easy. For example, other things like colonoscopy is actually quite complicated. The whole regime of when do you need to fast, what sort of things do you take, what is the regime, whether it's 1 liter, 2 liters, how many packs of laxative you add. All this is quite complicated. Recently, I just did one. So all these things we can help to explain the processes. How do you do something? Because right now, you just give a piece of paper and may not cover everything. And we also don't want to overwhelm the nurses, because most of the time we just call the nurses. So finally, these are conclusion slides. So summary of benefits. So large language model offers clinical benefit in patient education, 24/7 access to personalized, consistent, multilingual health information. Some of the key information is make sure there is something that is in the current system already. You need to have proper training. You need to monitor whether there are people using it, and then refine further. Make sure that they don't upload private information into the system. Make sure that information is accurate, because they're still liable. So that's why it's good to have some disclaimer. Future direction, how do you integrate text, voice, and visual input? How do you make it even into a health coach, so you can actually track and give actionable items? It's not just going to be something that's passive. You actually actively tell you you're not going for exercise so long. What happened? Can you do something about that? And it can also real-time monitor through wearable devices. And then some of the final thoughts are that there's a transformative potential LM in just patient education. Today, our talk is focused on just patient education. We've not gone deeper into other areas, which I'm happy to share in future. Encourage ongoing research and collaboration to overcome challenges to maximize benefit. And then if there's any interest in collaboration in any way, please feel free to contact me. Thank you so much for listening. Thank you.